One key element of protecting yourself and protecting others is proper hand hygiene. Hand hygiene must be performed after all PPE is removed. Even if your hands appear clean, the process of removing and handling soiled equipment could result in unseen hand contamination. Following removal of PPE, hand hygiene can be performed with an alcohol-based hand rub or by hand washing. If a hand rub is used, dispense the product onto the palm of one hand and rub hands together, covering all surfaces until hands are dry. If your hands are visibly contaminated, they must be washed using soap and water. The first step is to wet your hands and apply a small amount of liquid soap into your palm. Rub vigorously until lather appears and continue for at least 15 seconds. Be sure to scrub between your fingers, under your fingernails, and the back of your hands, as well as the palm up to your wrists. Then rinse your hands under running water. Dry your hands with a disposable towel. Using the towel as a barrier, turn off the faucet. We've given you a brief overview of personal protective equipment and how you can use them to protect yourself and protect others. Now that you understand the importance of proper procedures, here are a few things that you should remember. First, put on the PPE before you have any contact with the patient, generally before entering the room. Second, once you have PPE on, use it carefully to prevent contamination of yourself or environmental surfaces. Third, when you have completed your tasks, remove all PPE and discard it in the receptacles provided. Finally, perform thorough hand hygiene before going on to the next patient. Remember to use appropriate hand hygiene with soap and water or alcohol hand rub. Thank you for watching. I hope that you have a better understanding of the proper selection, use, and removal of personal protective equipment. It is important to follow the steps provided today. Think about what you need to do to protect yourself and protect others.